wish it were as black and white as everyone seems to think in this room. It's so easy as cutting off the program or changing this or changing that. I'm here today to bear witness. I'm an artist. I don't really care about Republican ideology. I don't really care about Democratic ideology. I care about people. I'm here to bear witness. This is a woman I painted. Her only crime is that her husband died when he was 55 years old, leaving her uninsured. As an uninsured person for 18 years during that time, she suffered an eye problem and tried like heck to get treatment. And by the time she did, she lost 85% of the vision in one eye because she was an uninsured person and unable to access the system. She waited 18 years to get on Medicare. One of my big concerns is that the so-called plan supplement is simply a chunk of money that seniors will have, and if they require a policy that gives them more coverage than what that money will pay for, they are stuck because this woman couldn't even get the money to get an eye operation. Where would she ever get the money to add to her Medicare supplemental plan supplement payment? I encourage everyone to come and bring your bankruptcy papers, to bring your medical bills because you're underinsured, to bring pictures of people who are maimed and dead because they could not access the for-profit system. Isn't the greatest system in the world? It's awesome, if you can access it. And so I encourage everyone to have the guts to say to their neighbors, hey, what's your insurance? How are things? Are you adequately insured? You know, what's that costing you? People don't talk about it. So I would like you to address the Medicare supplement, plan supplement, which I see is lacking because what if a person doesn't have enough money to supplement the supplement that they're getting to get the policy that they need?
Yay!
And I'd love to paint your portrait for the project to hang next to all these other Americans with their stories.
Yeah. Healthcare was a very emotional topic. It was debated in 2009, passed in 2010, and the gentleman earlier, you were asking about the jobs, what happened, why they're not coming back, why is corporate America sitting on $2 trillion, sitting on the sidelines, and not creating jobs? Good questions. I think there are a lot of reasons for that. One reason is the increasing cost of healthcare.
Right.
Right, we saw the article. My opinion, I'll respect those who disagree with me, but it's my opinion, when the federal government adopted its plan to require businesses to provide certain levels of insurance to their employees, which had not heretofore been required by the federal government, that many businesses, including small businesses, decided to retract, decided not to invest, decided not to invest in that new piece of equipment or hire the new employee to operate that piece of equipment because healthcare costs are well exceeding the sort of rate of inflation and growth of the economy by several times. And that's the heart of the issue. The reason we have so many million uninsured in this country is not that people want to be uninsured. It's not that employers don't want to adequately insure their employees. It's that costs are going up, and we have to have, just as we had the discussion about what's the proper level of debt or debt ceiling, we have to have a discussion about why are healthcare costs out of control in this country. The greatest, as you acknowledge, the greatest healthcare system that ever existed on the face of the earth. We're living longer. Why are we living longer? We're living longer because physicians are able to keep us going.
Is this okay? Is this okay, everyone?
No.
Is this okay? No. How is it the best healthcare system in the world when this woman can't access it? All I want to hear from everyone in this room is, this is okay because we need to keep the status quo. Do we need to keep, I was a business owner for 2 businesses.
We need healthcare reform. Healthcare reform creates competition among insurance companies so that you have better quality, better coverage at a lower cost. That's what competition does. That's what the free market does. It increases competition.
I was in business for 10 years. I understand the free market.
Number 2, we need association health plans. for cross-state purchases. I'm for association health plans to let small businesses like your own band together with other businesses and get the same bargaining position as large corporations have when they buy their health insurance. I'm for medical liability reform so that physicians who are trying to practice, sometimes in clinics, afraid of getting sued, giving free service in a clinic. Physicians take a Hippocratic oath. Physicians want to cure people. But physicians are being encouraged not to jump in to treat an uninsured patient. They're being actually encouraged just the opposite, to order 2 and 3 and 4 tests when one would do. It's called the practice of defensive medicine. It costs us billions and billions of dollars. So I'm for healthcare liability reform. And I'm for all those things that I believe will reduce the cost of care.
This woman would have her eyesight today. If this woman would have her eyesight today if the Affordable Care Act were in place. What I'd like to hear from you, yes, she would.
Yes.
Anyone have a question about that? Because she was insured under her husband's plan, and he died, and she's not an employee of his employer.
Should she get Medicaid?
She did not qualify for Medicaid because she made a little bit too much money. I have several people that I have paid.
It's true.
People are lying about their lives. People are lying. This woman's lying.
I think you made your point. The military doesn't pay a copay. The military doesn't pay HMO. I know I'm a veteran. They get the best health care in the world. And they don't, it's not for profit. It's single payer.
Well, that's a whole different subject.
Right.
There's
It's the best in the world.
for that.
That's right.
What I'm saying to you is don't throw away the ACA. This woman would have her eyesight today because she could get it as a she could get it as a because she has a pre-existing condition, and it would cost her about $280. If you have better ideas, I'm asking you, as for her and for all the people who I paint, to work with what's there and save the people who are being saved now, and continue to build or change on what is, so that these people don't fall through the cracks. That's what I'm asking.
Thank you.
All right?
Thank you.
Yay.